MS Ramaiah University of Applied Sciences.
Determination of erythrocyte sedimentation rate. Aim of the experiment: to determine the erythrocyte sedimentation rate in the blood sample and to indirectly measure the presence of inflammation in the body. Introduction. ESR reflects the tendency of red blood cells to settle more rapidly in the face of some disease states. The determination of erythrocyte sedimentation rate at which the red cells sediment or settle is often required to rule out the presence of organic diseases or to follow the progress of a disease. ESR is generally done as a part of complete blood tests. Thus, the purpose of this experiment is to study the significance of ESR in ruling out the presence of organic diseases. Experimental setup: disposable syringe and needle, sterile cotton swab, 70% alcohol, vacutainer, Pasteur pipette, Winthrop tube and stand. Experimental procedure: draw 2 ml of venous blood and transfer it to a vacutainer containing anticoagulant. Mix the contents well by gently inverting the vial few times or by swirling it. Do not shake as it may cause frothing. Use the Pasteur pipette. Fill the Winthrop tube from the bottom of it. Ensure that there is no air bubbles trapped in the blood. Transfer the tube to its stand and adjust the screws so that it will remain vertical. Leave the tube undisturbed in this position for 1 hour, at the end of which read the millimeter of clear plasma formed above the red cells. Analysis: ESR is raised in all organic conditions such as acute and chronic infections, bone diseases, all malignant diseases, nephrosis, trauma, surgery, all anemias, in contrast to functional disorders. And decrease in ESR may be seen in polycythemia, anemias, afibrogenemia and severe allergic reactions. Precautions: proper anticoagulant should be used. The blood should be collected in fasting state. Clotted or hemolyzed blood should be discarded. The tube should not be disturbed from the vertical position for the complete duration of the test.
Hi students, today we are going to study erythrocyte sedimentation rate. The aim of this experiment is to study the significance of erythrocyte sedimentation rate in ruling out the presence of organic diseases. Erythrocyte sedimentation rate reflects the tendency of settling of RBCs, that is red blood cells, in the presence of diseased conditions. Erythrocyte sedimentation rate is usually done as a part of complete blood analysis. Now we are going to study different components which are used in this experiment. Disposable syringe is utilized to draw the blood from the veins. Vacutainer, which is usually pre-coated with an anticoagulant. In this case, we are using EDTA vacutainer. Dry cotton swab is used to wipe off the excess alcohol. Cotton swab with 70% alcohol is utilized to sterilize the area. Winthrop tube, which is open at both the ends and contains graduations from 0 to 200 mm, and the blood containing the anticoagulant will be filled in this tube. And stand. The Winthrop stand, it can hold 3 to 6 Winthrop tubes at a time, and it is provided with a spirit level to ensure that the tubes are held vertical throughout the test. Now let us start the experiment. First, let us collect the blood. We will collect the blood using disposable syringe. Now we will collect the venous blood. After the blood is collected, it is transferred into a container or vacutainer containing anticoagulant, and the contents are mixed gently by inverting the vial few times. Do not shake as it may cause frothing. Then, using the Pasteur pipette, the Winthrop tube is filled with the blood and ensure that there are no air bubbles trapped. Then the Winthrop tube is vertically fixed to the Winthrop stand. Now let us fill the blood in the Winthrop tube. Now let us fill the blood in Winthrop tube. The blood is filled in Winthrop tube up to the mark 0. After filling it to the mark 0, the Winthrop tube is fixed in Winthrop stand. After fixing the Winthrop tube in Winthrop stand, leave the tube undisturbed in this position for 1 hour. At the end of 1 hour, read the mm of clear plasma collected above the red cells. Now, at the end of 1 hour, we can see the erythrocyte sedimentation rate. We can see the plasma, which is 6 mm, which is within the normal range. This completes the study of erythrocyte sedimentation rate. Thank you.
At MSR UAS, we spark your imagination unlike any other.